Brainspotting is a neuroscientifically backed treatment for trauma and PTSD, but it can also lower your anxiety baseline, treat phobias, depression, and many other things in some cases. Brainspotting uses an eye position in order for a therapist to help you activate and process a traumatic memory. This is accomplished by the patient looking at a pointer. Sometimes you wear a pair of glasses that covers up one eye, like these, but not always. The majority of the time, you're following a pointer that looks like this. There's no machinery, there's no equipment. Occasionally, a therapist will use bilateral stimulation by having you listen to music that jumps back and forth between either ear, but the majority of the treatment just involves watching a pointer that a therapist is holding. Brainspotting can help you access the subcortical part of the brain where trauma is stored. This is the body brain. It's the part of our brain that's close to our brainstem, and a lot of times with a traumatic event, we feel the trauma physically. We react to it physically, and we adopt a defensive posture. Our body energy changes. My heart gets cold, or my chest gets tight, or I start to sweat, and I immediately have a physical response first, and then later my prefrontal cortex personality brain starts to think about it. So it's very hard just by talking about trauma to process it. Brainspotting works very quickly because it takes you deep into that subcortical brain where you have a heightened body awareness a lot of the time, and you also have a deep emotional presence. The trauma is able to be processed and be let go so that the triggers that you are coming in with are not as activating to you. Brainspotting is one of the fastest treatments for trauma and anxiety that I've ever seen as a patient or as a provider, and it works very quickly. If you have any questions about Brainspotting, please send us an email or give me a call.